Good afternoon. Namaste to Her Excellency Dr. Tamilisai Soundararajan, Governor of Telangana State. Madam, I would like to bring to your kind attention that people of Telangana have been suffering like anything due to exploitation by the private hospitals for treatment related to corona and its related diseases. They are charging huge amounts starting from 5 lakhs minimum to 50 lakhs and even more, but there is no guarantee and availability of medicines, oxygen, etc. The labs is still existing. So I request you to act in your capacity to save the people of Telangana by instructing the government to include corona and related diseases into Aarogyasri and fix up price cap of maximum 1.5 lakhs so that people will be able to survive. Otherwise it will be very difficult. As you aware that from the previous lockdown itself, people have not recovered yet financially, as many have lost jobs, and there are many financial difficulties people are currently going on, and on top of it again another lockdown started. That is an added burden on them. Despite all that, if the hospitals act like this in this crucial situation where the pandemic is spreading like anything, in a single family there are many casualties being seen. So in such situation people are not even finding to eat properly. So that is the condition. So on the humanity grounds, I request you to act in your capacity and instruct the government to either have control on the fees being charged in the private hospitals. A price cap must be fixed at 1.5 lakh, not exceeding the 1.5 lakhs. They should treat anything related to corona and corona related diseases. So if this can really help the people in their survival, otherwise it will be very difficult for them, and many people are not even able to not even have money to eat. The basic necessary itself people are missing. Government blindly and suddenly imposed all of a sudden lockdown, despite the honorable high court have been warning them from months, but they ignored the warnings and they suddenly decided. When the high court came on them very seriously, then they immediately decided and imposed the lockdown without seeing the consequences and without making any proper arrangements for the unorganized sector, daily wage laborers, etc., and migrant laborers. I don't know how they are surviving currently, but the hospital loot is at very peak, very high, ma'am. And even the life-saving medicines like remdesivir and oxygen shortage and the vaccine shortage are adding to the pressure. So I request you to please intervene and save the people of Telangana by instructing the government in appropriate way to take measures to fix up the price cap on corona and related diseases and add it into Aarogyasri, and every hospital must cover. Otherwise, government must impose complete health emergency in the state and take over all the hospitals until the pandemic is completely gets over. And as you aware that we have very less number of government hospitals, so that is the reason why people have no other option but to approach the private hospitals, where even if you have insurance, many people are not ready to accept. Even if they accept, they are just waiting for insurance coverage to get over, and then they are sending back to the government hospital where the people are dying due to lack of treatment, lack of availability of beds or doctors. There is the kind of situation. So as a head of the state, I humbly request you to act and save the people. Ravi Krishna, a social activist from Telangana.